Is COVID-19 starting to go away? I'll explain. After a devastating post-holiday surge in coronavirus cases, data has suggested that the United States COVID-19 cases have fallen by 50%. From the time that I'm making this video, the United States is experiencing 68,000 cases per day. So are we finally seeing a decline? Working in the ER, I've noticed firsthand that compared to a few weeks ago, not nearly as many hospital beds are occupied with COVID patients. So what exactly is going on? Hey everyone, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds to burns, you name it. I've created this video series to help answer your questions and the questions that I get from patients each and every day like you. If you find this video helpful, please hit that subscribe button so you're notified when I post new videos. The rapid decline in COVID cases in the United States likely has many origins. Today, I'm going to be breaking down the top 4 reasons as to why COVID-19 cases are currently steadily declining. Let's break them down. Number 1, good behavior. COVID-19 related hospitalizations and deaths have declined slightly. However, the emergence and spread of more transmittable variants of SARS-CoV-2 could jeopardize the progress we have made in the last month if we let our guard down. Let's not forget that we had a huge surge of new cases as a result of having Thanksgiving, Christmas, and New Year's in rapid sequence, all while new undetected variants were spreading. Now that the holidays are over, we're not gathering as much indoors, therefore resulting in slowing the spread of transmission. But where the quote good behavior comes into play is individuals are also being more careful. It took a miracle to get some people to even wear one mask, but some of us are even opting to double our masks or buy N95 or KN95s. For the record, the CDC has come forward promoting doubling up on masks, implying it can in fact significantly reduce COVID-19 transmission by reducing viral load. Number 2, increased vaccinations. The continued scale-up of vaccination helped by the fraction of individuals willing to accept the vaccine has possibly made a minor dent in the decrease in COVID-19 cases, mainly improved hospitalization numbers. In the past week, the country collectively administered 1.62 million vaccine doses per day, according to the Washington Post's analysis of state and federal data. This topped the White House's original goal of 1.5 million vaccinations per day. Experts have said that 70 to 90% of people need to have immunity either through vaccination or prior infection to squash the pandemic. But again, not enough people have been vaccinated to make such sizable dent in the case rates. But it's getting better. Number 3, decreased testing. Not to be a Debbie Downer, but some new cases of COVID-19 might actually just be going undetected. There's been an increased focus on vaccine distribution and administration, which is good, but it could actually be making it harder to get tested. Also, winter months continue across the country, and a lot of outdoor testing sites we have had access to in this country can't operate in the middle of a snowstorm. But circling back to the holidays, the US produced an artificial spike of reported tests in early January. People were traveling and visiting loved ones and wanted to ensure they were negative before jetting off to their destination. Some airports even had testing sites set up. However, it's still the wrong mindset to shift towards, as we need to understand the movements of the virus during a slow vaccine rollout and the spread of multiple new variants. Number 4, natural immunity. We have tried to reduce the number of people infected with COVID-19, but as we know with the numbers and the stories we have all heard, we haven't done the greatest job with it. And sadly, we've lost a lot of people since the onset of COVID-19. On the flip side, we have a ton of people that have gotten infected with the virus and recovered. With the number of recovered patients likely having some good natural immunity, coupled with the vaccine rollout that is currently happening, we are getting to the point of slowing the spread and some community protection, but not yet herd immunity status. No matter what's causing the current downturn in new infections, experts have urged Americans to avoid complacency. It's encouraging to see these trends coming down, but it's important to realize that they are coming down from an extraordinarily high place. So we need to continue to take the right steps in order to fight the virus and be done with it once and for all. Masks, distancing, ventilation, avoiding large, specifically indoor gatherings, getting vaccinated when eligible. These are the tools for success. The end is almost near, but is not quite here yet. So please stay vigilant. Alright, that's been a quick COVID conversation with me, Dr. Wagner. Are you guilty of letting your guard down just because the numbers are dropping? I hope not. Or are you still practicing consistent mask wearing and physical distancing like you should be? What other contributors do you think are bringing the number of cases down? And are there any other COVID-19 topics that you'd like me to make a video about? Please leave me a comment below. And make sure you subscribe and turn your bell notifications on right here. When you do that and hit that like button, you let YouTube know that you'd like to see more videos like this one. Alright, thank you so much for watching and stay healthy, my friends.